Yeah, so I would like Dr. Poonachandra sir and AIOS for giving me this opportunity. So I'll just present one case which actually made us wonder that is actually abnormal, actually abnormal. So there is a 30-year-old female patient who came with the complaints of like a general OPD the way they come, so that with floaters in both the eyes since 1 year. Along with that, when we started digging a little more, so then she said there is difficulty in the dark adaptation in both the eyes since 1 year. No history of glasses, no significant systemic history, family history. On examination, anterior segment or visual acuity, best corrected vision. There was some amount of astigmatism in the left eye, so she was best corrected vision was 6.6. Pressures normal, color vision normal. Anterior segment findings normal. Fundus examination, we found some, like on clinical examination, some pigmentary changes that we could make out at the center of the macula. Then on pedigree, nothing significant came out of the pedigree as well. But on fundus examination, like I said, so there were some pigmentary changes which we could make out with the altered FR or a dull FR that we could see in both the eyes, so right and left. And going ahead, we did an OCT. Now in the OCT, if we look at the right eye OCT, we can see some thickening of the interdigitation zone subfoveally with thinning of the RPE. And in the left eye, there is loss of like a focal loss of interdigitation zone subfoveally and with thinning of the RPE. FAF, right eye looked absolutely normal. Left eye, some alterations were seen, but then again, not significant enough for us to understand exactly what is going on. On ERG, all the ERGs were normal. So these are different types of ERG where I've put the patient's ERG and the normal ones that we see. So, and to our surprise, even the MF ERG was normal. Now, the pattern ERG in this case was not done. So, the case in this case means we were not able to arrive at the diagnosis in this particular patient that what exactly is going on. So, we advise screening of the family members and testing of the genome sequence, which the patient is yet to get it done. So, I would request our panel to actually comment on this, that what are we exactly looking at.
Sure. Can just go back to the OCT, and I would like to ask comment from Subhadra ma'am and Parveen ma'am on this case. Everything fulfilled, even multifocal is normal, as you can see. This patient is a ophthalmologist, right? She's a doctor.
Yes, yeah. She's a medico. Yeah.
To me, it seems that there is some abnormality of the retinal pigment epithelium in that area. If you go to the next slide,
Interdigitation zone is enlarged, ellipsoid is intact,
So
RP
your
is thinned out.
multifocal ERG, the thing is that the central peak, it's only telling the central 5 degree or something, and it is only one stimulus there.
Right.
So sometimes if there are lesions there, it may not pick up because it's only a single stimulus. So we would need to see little more. But I would suggest that this patient we should check for color vision.
Normal.
Second,
color vision is normal.
Yeah, and just keep under observation. I'm not thinking of a retinal dystrophy at this point of time.
Yeah.
I'm just thinking that maybe there is just some sort of RP degeneration. Sometimes, patients have had some solar retinopathy or they've had some exposure to some chemicals. So I would find out. Sometimes patients are taking a lot of, non-medical stuff. So that can lead to, or some drugs, which they may not reveal to us what drugs they're taking, or they may be non-prescription drugs. So some drug toxicity is one of the possibilities. And otherwise, I would just think that there is something benign and we just watch.
So one last comment from Parveen ma'am before we wind the session. So sorry we are not able to take the questions. We'll be just outside the hall after this session. If any of you have doubts, you can just ask us. We'll be around for another 5-10 minutes. Ma'am, last comment from you.
I think sometimes adult vitelliform disease can also present like this because you don't have any visual issues. Electrophysiology, all tests are usually normal in this. So
exactly.
EOG also may be normal actually.
Okay, EOG we have.
Exactly.
Okay.
That was the thing.
One of the differential for mind.
Right.